Hello, my name's Sarah Jane Rogers and I'm working with the Clinical Genetics Department at the Leicester Royal Infirmary. This podcast is about the potential benefits of patients with cancer having vitamin D supplements. There is a consensus statement from Cancer Research UK and a number of other medical organisations, and the link to this is found next to this video. Vitamin D is responsible for the absorption of calcium and phosphates in the intestines. It can be taken in with food, but can also be made by the body from cholesterol if the skin is exposed to sunlight during the summer months. Recent studies have shown that patients with higher levels of vitamin D in their blood when they were diagnosed with cancer were much more likely to survive than patients with low vitamin D levels. A 2009 study by Cancer Research UK used many factors to estimate the levels of vitamin D in a patient's blood at the time of diagnosis with bowel cancer. They found that these people with higher levels of vitamin D were 50% more likely to survive the disease. It has also been found that patients with skin cancer or malignant melanoma who had higher levels of vitamin D when they were diagnosed have thinner tumours than those with low levels. Often, melanoma patients will avoid the sun as sunburn can increase the risk of developing tumours. These studies both suggest that having high vitamin D levels can improve your chances of surviving some cancers. It is thought that this happens because of the impact vitamin D has on genes. Vitamin D has been shown to have a direct impact on around 300 genes, most of which appear to be linked to autoimmune diseases and the immune system. It has been suggested that having higher levels of vitamin D can help the body's immune system to fight cancer through its effect on these genes. The research carried out by Cancer Research UK seems to indicate that having higher levels of vitamin D in the blood can improve chances of survival for certain types of cancer. It is, however, important to achieve a balance between sufficient vitamin D levels in the blood and the amount of time spent in the sun. There is a lot of evidence that shows how important it is to avoid sunburn at all costs, as it can increase the risk of developing melanoma in the first place. People particularly at risk of sunburn and melanoma are people with red hair, fair skin, or a family history of the disease, and these individuals should be particularly careful about the amount of time they are exposed to the sun. Whilst fair people may be at a higher risk of melanoma if they spend too much time in the sun, there are certain groups who are more likely to have vitamin D deficiencies than others. These groups include people with naturally brown or black skin, as they need more exposure to UV light to increase their vitamin D levels than Caucasians. Individuals who don't spend much time outside or the elderly are also more likely to be vitamin D deficient. People such as these who are concerned about their vitamin D levels or who do not spend much time in the sunlight can supplement their vitamin D levels through their diet. Foods such as oily fish, meat, eggs or vitamin D supplements can be good sources to boost levels of vitamin D. It is important that vitamin D levels are not too extreme in either direction. Whilst the studies show that higher vitamin D levels can increase the chance of survival with bowel and skin cancers, there is also some evidence that indicates that very high levels of vitamin D can be harmful too. Much more research needs to be done to show exactly how vitamin D can improve the chances of survival with bowel and skin cancers. How it does this through its effect on the genes is not yet clear. Researchers at the University of Leicester are currently looking into how vitamin D may impact on survival rates of other cancers, as well as the long-term effects of having high levels of vitamin D. If you have any further questions regarding the impact vitamin D levels may have on how people survive cancers, please do not hesitate to contact your GP. If you are interested in finding out any further information about this or related topic, you may find our other podcasts on diet and cancer, symptoms of cancer, HNPCC and familial polyposis helpful. Thank you for listening.